Hi, my name is Dr. Sherry DeSchaff. I am a physical therapist specializing in women's health and orthopedics, and I am 40 weeks pregnant today. So in an effort to distract myself from waiting for this baby to come, I thought I would make you guys a quick video on some of the exercises that I'm still doing at this stage of my pregnancy, and you hopefully can be too, and should be doing all the way through your pregnancy. So we're going to cover a few different exercises, lower body, upper body, and one for the core. I hope you enjoy them, and if you have any questions or concerns, please feel free to contact me by email or by phone, which you can find on my website. So the first thing we're going to cover is a squat. This is one of the exercises that every woman really should be doing through her whole pregnancy. If you're pretty fit and in shape and you're used to lifting weights, feel free to continue to do your squats with some weight. Your physician might have some recommendations for you on how much weight they want you to lift, and so I would definitely discuss that with your healthcare provider. For me, I was lifting about 40 pounds before I got pregnant, and so I've kept it to between 30 and 40 pounds for my squat lifting at the gym. But it's completely fine and still very beneficial for you to do your squats without any weight at all. You can just do them at home, and it's really, really good for your body, for your pelvis, for your back, and for your core, both for flexibility and for strength to prepare you for labor and delivery. So we'll go over squat form first, proper form. Anytime with any of your exercises, you want to start with maybe 2 to 3 sets of 10 if you're not a big exerciser. If you're already exercising, 3 sets of 20 is probably a good goal to go for. Anytime we're pregnant and we're lifting weights or doing resistance training, we want to keep in mind that the goal is not to be able to be an Olympic lifter. It's not to increase your weight a whole lot through your pregnancy. It's just to keep up your tone and your fitness level. So we want to focus a little bit more on high repetitions, getting your heart rate up, keeping some muscular tone, not so much lifting big heavy weights. So for a squat, I'll show you from the front first. We're going to go feet a little bit wider than hip width apart. My toes are pointing forward. I know you can't see them on the camera. I apologize for that. When we come down, we're going to squat with the hips going back so the chest comes forward. And as I look down, I can see my toes the whole time. So the knees are not going in front of the toes, and the knees are also not collapsing in towards the center. They should stay right in line about with your second toe. So down and then up from the side, so you can see that my back stays nice and flat the whole time. My core is engaged, as are my glutes. We're going to sink back, keeping the knees in line with the toes, using the glutes to come back up. For my breathing, I like to go in on the way down and out on the way up. It's just the way I like to do things, but as long as you're continuously breathing and not holding your breath, you should be okay. Little variation on your squat, you can do a plie squat, where you're just rotating the hips out a little bit. So your toes and your legs are rotated out about 45 degrees. You still want to keep the knees in line with the toes. If they're not collapsing in, that puts a lot of stress on your knee. And you're still just going to go down as deep as you're comfortable and then back up. Those hips are going to go a little bit back behind you so that you maintain your balance. Now after you've done your 3 sets of 10, 3 sets of 20, whatever you decide is good for you, good thing to do is to go drop into a little bit of a deeper squat to really stretch out the hips. Make sure that your body's still capable of getting into that really deep squat position, which is a very popular position for the pushing phase of labor. So you want to make sure that your body stays able and flexible to get into that position. Not sure if you're going to be able to see me on the video camera again, but I'm just going to drop down as low as I can get with my knees wide and kind of let my back and my pelvis stretch into that position. So to show you that position again so you can see a little bit better, I'll come up onto my ottoman here. My toes are out, my knees are out, It actually feels kind of good to do this against the wall if you have somewhere that you can do this. Just letting the flexibility remain in those hips.